The IT issue lies with the rumors about microchip implants spread with the creation of the Affordable Care Act. In 2009, Obama proposed the Affordable Care Act in order to provide for better medical insurance. Some of the conditions under the policy were planned to be enacted during the following years, starting from 2014. So what exactly is the problem with this? Well, with the creation of ACA, many people misinterpreted the government's intentions to keep a database for medical information which would help in improving overall health services. People started to spread rumors that Obamacare would in effect require mandatory microchips to be implanted on every person eligible for the aid. So the stakeholders, according to this article or this situation, would in effect be the American citizens. The overall problem with the spread of these rumors led to the state of alert and uncertainty from these citizens. The implications of a microchip implant included ideas of dystopian governments and the invasion of everyone's privacy and completion. Though the rumor is not exactly true, microchip implants would have in effect led for the citizens to be the stakeholders of this new technology, as they would be monitored and used as data for unknown purposes. So, some background on microchips. Chips are found in different objects such as passports and card systems and have facilitated the process of validation in many countries through the use of these, even in passports, though the use of these, even in passports, has led to some controversy. Contact with living organisms appeared with the ability to place a chip in your pet. This permits the owner to track and find their pet if it were ever to get lost. Human microchipping experiments started as early as 1998 and have since been subject to experiments and further development, but they've never been forced on any person who is not willing to get one. Part of automatic identification and data capture technologies, which use different barcodes and specific identification numbers or codes, are just a part of this new technology. The type of system that microchips use, or human implants, are the RFID system, which stands for Radio Frequency Identification. The chip itself serves as a tag which uses radio frequency electromagnetic fields. They are protective of certain information and also use the technology for tracking purposes. So how this works is, 1. The system uses tags and labels which are attached to the objects that are to be monitored. Then, the interrogators, or the readers, which are known as two-way radio transmitters, send a signal to these tags and read the response. The tags have assigned numbers which are used to then transfer the information into a database. The way they do this is by mutually establishing a connection between the antenna present in the external system alongside the internal chip antenna, which is in effect a form to send information to the reader, which then translates and decodes this and sends it to a computer. The electric chip itself is made up of two parts. 1, an integrated circuit, which stores and processes information. It modulates and demodulates radio frequencies and gets power from the reader itself. And the second part is the antenna, which will receive and transmit the signal as seen in the images. So other uses for this, aside from human microchips, which use RFID technology, are other very popular innovative applications of the RFID tag systems, which are present in other areas of our daily lives. These include the following: highway toll pass cards, subway passes, cattle monitoring, retail management of merchandise, library cards, and in some places even passports. Now I will talk about the problem. There is a risk of the use of microchips as being surveillance devices which can place citizens and people in a state of alert. The invasion of such private space, such as the human body, is overall the most sensitive of issues. This is due to the fact that the person who is implanted with the microchip is now subject to another person or system who may invade one's own possession. So in a sense, we wouldn't truly be owners of our own personal information because we'd always be monitored. Even though there are governmental policies and regulations which are enforced with the use of microchips to make it both safe and reliable, the ethical issues surrounding this practice are a more significant contributor to the opposition that exists towards human microchip implants. There are both negative and positive impacts to this new innovation. So the positive impact consists of possibly improving medical databases and information, which may lead to overall better medical services. This system can also facilitate daily functions through the ability to control some of your personal technology-based devices. There was an example or a case where a man was able to turn his car on or open doors using the chip he was implanted with. This could also aid in the case of criminal investigations and with finding someone if they were ever to get lost. Some of the negative impacts include the following. This system enforces surveillance and tracking technology similar to that of GPS systems. Very personal and sensitive information plays the risk of being positively distributed or used for detrimental purposes. This leads to an invasion of privacy and also the possibility of other sources which may develop some sort of technology that would help interfere with the signal and therefore receive the information and data without being detected. Ultimately, the implants place your entire being at the hand of a third-party operating system, which in cases may imply ownership of your information. So, without regards to the American citizens and their rumors, the idea or the implementation of this technology may spread to many other countries which have explored the uses of these implants and would most likely plan to put them into use in their near future. Furthermore, the operators behind the control and monitoring of the databases would have to be careful with the use and management of the information, as any illegal distribution of information or even hack in the system would lead to the decrease of reliability overall. This would cause a reaction of possible alert among those who have microchips. People from countries who have access to these microchips would in effect be other stakeholders, as well as those who control and monitor the trackers and databases. Further examples of the tension raised by the use of RFID technology was seen in another article and case where a girl in Texas, a student, was against the idea of using an ID which had RFID trackers in it. The chipped IDs were supposed to aid the school in bringing attendance up, and this just enforces the notion that the kids were always under surveillance, and in a sense they were being controlled to do something so that the school could gain some money from their records of attendance. She was suspended from school because she refused to wear it. Punishment for the opposition to using a tracking device. The device in this case was placed in their school IDs, so the fact that this was a problem can give some perspective as to the ethical sensitivity that surrounds the use of human implant microchips. So some possible IT solutions include investing in further development and research to overall improve the system. Microchips are barely becoming popular, or just becoming popular, which is why it would be best if there were further development of the system itself, which would produce conventional control from both people and the operators. This would include such things as limited control of the function of the chip, while the third party has control over more relevant areas of information received from these signals. Another solution may be to create security systems which would resemble to the case-sensitive security systems which protect bank accounts, for example. Furthermore, like any system, there could be the possibility of some other malignant source hacking the database system. Almost with a computer, the ability to hack into a system like this would have a very negative impact in more than one area of people's lives, along with the management crews who are behind it. Therefore, something such as direct transmittance of signal to the correct antenna without being able to somehow connect to another would prove beneficial, or even enforced internal systems which would not be accessible to anyone unless they control it are possible solutions. Some other non-IT solutions which would address the ethical concerns would be to have the microchip implants be an optional thing rather than mandatory. Here we have an ethical focus which can be easily explained through the proposed solutions. So with the creation and adaptation of these microchips came the rise of socio-ethical controversy. In order to diminish tension or somehow minimize the clash of ideals, the people can be given the option of being microchip implanted rather than being implanted forcefully. This eliminates some insecurity and unrest in regards to the intentions of these devices. Furthermore, the idea of optional implants would in effect embrace the ideal of personal freedom and thus decrease the negligence of human rights. Another non-IT solution would be to establish better communication and inform the public of the uses and benefits as well as the security measures enforced within the system. This would overall help create a system of trust and reliability on the use of microchip implants on human beings. So overall, the use of microchips is an innovative form of technology that has both positive and negative effects overall, like any other new technological innovations created in recent times. The use of these implants could overall lead to positive effects to those who choose to have them. So in a combination of both solutions, a combination of these would help in effect to support the use and the creation of these new devices.